Hello, everyone, and thank you very much, Clive and Sherry, for inviting me to talk to you all this evening and help. And thank you for, as Clive said, joining me to hear me talk about understanding pain, what everyone needs to know and do. Essentially, as a society, our understanding of pain, what causes it, and what we should do to get better is unfortunately distorted by many myths. So I'm really excited to tell you about how pain science has changed our understanding of pain, and I hope it gives you some new ideas of how you can help yourself or others to prevent and reduce pain better. So why do we all need to understand pain? Well, if you have pain, you can certainly benefit from understanding it better. But generally, everybody should understand pain, as most of us, unfortunately, will experience pain at some point in our lives. So to understand pain better, we need to know about two basic categories: acute pain and chronic pain. As I go through the presentation today, please give some thought to which one of these applies to you. The first of them, acute pain, lasts for up to 3 months and is caused by a very definite injury, tension, or a disease event. Chronic pain, alternatively, is any pain that has lasted for more than 3 months. People often think that chronic pain means it's going to last forever, but actually all the phrase means is that it has been there for 3 months already. So why this 3-month time distinction? Well, traditionally, we've known that body tissues, bones, muscles, ligaments, and tendons tend to heal within the 3-month time. But also, as we'll see later, we now know that other factors come into play after 3 months that keep us in pain. Alas, pain is so prevalent that the World Health Organization in 2015 called it the silent pandemic. And when within the UK, a report in the British Journal of Medicine in 2016 estimated that 2/5 of UK adults have chronic pain. And whilst we tend to think of chronic pain affecting older people, this chart shows us that chronic pain is also prevalent among younger adults and middle-aged, with estimates of up to 18% of 16 to 34-year-olds having chronic pain. Indeed, currently, the majority of my clients are in that younger age group. But knowing about pain is crucial to help us make informed decisions of what to do, to promote recovery from acute injury and pain, to prevent acute injury or pain recurring or becoming chronic pain, and also to reduce and stop chronic pain. So within this presentation, we will look at the basics of pain science: why we have pain, what causes it, what happens within our brain and body when we have injury and pain, and also how what we believe, think, feel, and do affects recovery, and why doing helpful things quickly is best for recovery. Also, we're going to be looking at the best ways that people can look to reduce pain. Obviously, there's lots of information within this, so I'll give you some practical tips, which are kind of quite general, which hopefully you'll be able to find some useful things in there for yourselves. So if you're sitting there thinking, well, will this apply to me? Well, very probably, yes, it will if you have musculoskeletal conditions. The basic pain science I pertain to you applies to many conditions, including but not only any injury, fractures, sprains, and strains, headaches, necks, and back pain, pain to any joints, so shoulder, elbow, wrist, hip, knee, ankle, including osteoarthritis-related pain, IBS-related pain and pelvic pain, nerve damage, which is called neuropathic pain, which can come on after surgery or accidents or due to diabetes and stroke. Situations like sciatica, tendonitis, frozen shoulder, tennis elbow, Achilles tendonitis, and also chronic widespread pain such as fibromyalgia. So let's get going. Let's look at what happens within us when we have injury or pain. Well, the first thing to understand is that us humans are amazing. Again, as a society, I think we forget this. We've forgotten how millions of years of survival of the fittest helps us every day. But no, we have highly sophisticated systems that work together to protect and preserve us. If you can think of the fight and flight response, you've probably heard of this, where our body quickly changes to help us run away from or fight danger. Also, you'll know of these situations when we upright ourselves quickly, when we slip, when we look towards an unexpected loud bang, and also how we just recover from flu, an NSAID bike, a broken bone. All of these happen automatically without us thinking about it. Pain is another protective system. It alerts us to danger. It makes us stop or do things differently. It protects us so that we can allow ourselves to heal. Another extraordinary feature is that we learn from our experiences and physically adapt so that we can protect ourselves better into the future. So, for example, we all know that we shouldn't be touching something hot because obviously that's something we have learned throughout time. So my first key message is not what you're expecting to hear at all, I expect, is that pain is about protection. Pain science is very clear. Pain does not equal body damage, and likewise, body damage does not equal pain. Now, this is a very surprising fact for many people. It takes people a while to get their heads around this sometime. But I'm just going to give you a few examples from research and from many people's experiences, which kind of gives us a little bit of a way to think about pain being protection, or alternatively, at least something different from body damage. So the first of my examples is phantom limb pain. So phantom limb pain, you may have heard of it. It's when someone who has had an amputation continues to have pain. So we know that I think currently they're saying 62% of people who have an amputation will have phantom limb pain, and that typically it lasts for 18 months. So the question here is, how does this person continue to have pain if the pain site is no longer there? So for example, if they're amputated at somewhere in the upper arm, they will continue to feel pain all the way down to their fingers. So actually we know that people tend to feel pain more in the extremities of the limb which has been amputated. Another example is those of our emergency services, our military services, and also people who just find themselves in extraordinary circumstances throughout the day. So here you kind of find that people often sustain really quite horrible injuries, but they sometimes don't even know that they're hurt, or certainly there can be no pain. The situation here is that they're in a far greater danger, which grabs their attention and takes it away from the fact that they've actually hurt themselves. And we know that often it isn't until they return to a safe situation that actually the pain kind of comes. And then the third piece of research, now there's lots of it around at the moment about how scans inform us and what practitioners say to people with pain. But we know that what people are told about their condition affects how much pain they experience. So for example, there is research done on 400 people with back pain. They split them into two groups, all had a scan. Half the group were told that they had normal age-related damage. Others were told a very complicated term for something they had wrong with their back. Immediately on leaving the session, they were asked to rate their current pain and also given some simple exercises to do. Those who were told the better message, that it was just normal age-related pain and that people can continue with that situation within their back quite normally, those people reported less pain and also are able to do more than those who were told they had some complicated condition. And this situation continued as well into future months. So this should kind of get us thinking about pain as a different thing from body damage. What I really want you to know, however, is that those who have chronic pain is very much about protection and very little to do with body damage. Estimates of up to 90% of people with chronic pain do not actually have any body damage which can explain that pain. So what on earth is going on? So let's have a look. So here I have a very basic feedback loop. As with all our bodily systems, pain is controlled by a feedback loop involving our nerve receptors at the bottom here, our spinal cord and our brain, and the action set off by our brain to make helpful changes. This, of course, happens without our awareness. And when we have a change, so for example, here I've got someone holding their backs and maybe something's going on there, this will start off the loop. So let's look at each of these parts in more detail to see what's going on. So if we have any changes in our body or local environment, they'll be detected by receptors on the ends of our nerves. So for example, if you have a paper cut, a broken bone, you've been sitting too long, or muscle tension, the nerve receptors will detect it. But what is not commonly known is that nerves do not detect pain. We do not have pain receptors, pain sensors, or pain fibers. So although we feel pain in a body part, there is nothing there that in itself is pain or detects pain. Now, this is quite a big turning point for people often when I explain this to people. Instead, our nerve receptors can only detect three things: changes in temperature, hot and cold, chemicals such as stings, medications, those chemicals that create inflammation, and mechanics, stretch and pressure. If enough change is detected in these three things, messages are sent along to the spinal cord. Now, generally, our muscles carry information quite slowly, but we also have super fast messages, which are represented by these danger message over here, super fast nerve fibers, which if you have really too much of these will get fired along to the spinal cord. And it's classically these ones which cause the sharp pains that some of you may be aware of. But please know we can detect nothing else, just temperature, chemicals, stretch, and pressure. So if there is enough messages at the spinal cord will then either pass the information or not. And the thing here is that the spinal cord has an all or nothing threshold. So if there are enough change messages to take over its threshold, the spinal cord will allow the messages to go up to the brain. So essentially, the spinal cord is a filter that will only activate if there's enough change. A useful visual for this is a glass can only hold so much water. Once exceeded, the glass will overflow. So exactly the same kind of situation with our spinal cord. If there's lots of messages which takes over the threshold, information will go up to the brain. So what happens within the brain? So if the body's change messages get to the brain has three key roles to ensure that we are protected. The first one, you may know that the brain receives 11 million pieces of information every second. So it has to decide which messages to pay attention to. So one of the key messages that we are wired to pay attention to are things which relate to safety and danger. So what it's going to be saying is, are these messages from my body and environment important? If the answer is yes, then the second task that the brain will do is to interpret what it is. And the third one will decide, well, is this safe or dangerous? If it's dangerous, it will set up protective actions, which I'll look at in a minute, as needed. But what affects these three key roles? So let's go towards some examples. So first off, as we know, information from our body and also from the environment, things relating to temperature, chemicals, and mechanical changes that we've already discussed. But also, and crucially, this is something which is not unfortunately recognized much within our medical systems, that these three things, attention, interpretation, and decision, are also affected by our beliefs, values, knowledge, memories, and our emotions. So all the things you've learned throughout your life will help you to decide whether or not you need protection. As I said, it's one of those protective mechanisms. And obviously what we've learned in the past is there to help us with this. So let's give you some examples to make this a little bit more real for you. So in my brain now, I've got some messages coming up from the body and the environment. So the brain needs to decide, are we going to pay attention to this and what is it? So what kind of information may we have in our brains which can actually help us make that decision? Well, first off, it could be our beliefs. So maybe things like, oh no, pain means I've hurt myself. It may mean I mustn't walk. It will make it worse. Or a painkiller will help me carry on. These are the kind of things I hear very regularly. It can also include things like our recovery expectations. So maybe you've read something on the website. Unfortunately, the NHS website has things like this that many people don't recover. Oh, and it will get worse. Maybe you can recall someone you've known previously. For example, your gran had this condition and she ended up in a wheelchair. Maybe you're thinking, oh my goodness, I can't get to work. I can't sit for too long. I can't do the shopping. I can't do that 10K race I was going to do in 2 weeks' time. And other negative thoughts will get wired into here as well. So last time this happened, I didn't leave the house for months. What if I'm not better by my holiday? So everyone with pain has their own unique combinations of beliefs and memories about pain and what they and the medics should do about it. And it's because of this, there's only a unique set of thoughts and memories and experiences that everyone's pain and how to help everyone's pain is very different. So in the brain, all these thoughts connect together to form a network. This is learning, one of our best survival adaptations. Why? Because it means that we can quickly find and use all the relevant information that we have to make the right protective decision. This is why people's context is important to pain. So you may have noticed that there's times when you're reminded or you think of something in particular. Maybe you see someone in a wheelchair and you think, oh my goodness, I might end up with that. And it can trigger this whole chain of connections. And this will affect the brain's decision of are they safe or are they in danger, and thus whether they feel pain. So in our example, the person's brain had decided that they're in danger. So their brain sets off an array of systems to protect them. I will discuss the most helpful ones here. So first off, it's going to affect our sympathetic nervous system. So earlier we very quickly mentioned the flight and fight response. Well, when this is triggered, it leads to increased number and sensitivity of nerve receptors in the body area. So repeat that again. When our brain thinks that we're in danger, it will put more nerve receptors and release chemicals that make it more sensitive in that area. Why? Well, the brain wants to make sure that it's aware of any further changes. So obviously it can continue to do what it can to help. Also, the increased flight and fight response will also affect our sleep, which can impair tissue repair. The second key system is our immune system, and we're finding out more and more now about the relationship between the gut, the brain, and the immune system. So activation of the immune system can lead to inflammation. Great in an acute injury situation, but less so when it comes to a chronic pain situation. And of course, we know that chronic inflammation is associated with many pain conditions. Finally, and this is something that you probably are very aware of, it can lead our muscles to tense up, to move differently, and to stop us from doing certain movements altogether. So I've got a word there, guarding. Guarding is when we protect an area when we move. So it may well be that you are aware of the last one, even if you're not so aware of the others. And so we have our amazing feedback loop, all about protecting ourselves. The brain is ensuring that the body is primed to protect, doing all it can to bring pain so that the person will protect themselves from danger, do something different, move different, both for now and for the future. But one other useful thing to add here is how our emotions affect this process. And this is one of the things that my clients often tell me, that negative states, stress, anxiety, feeling low or tired, increases their pain. Alternatively, they don't tend to notice pain so much when they're distracted or having positive experiences, such as being happy, interested in something, or having hope. Well, why? There's numerous reasons for this, but one of the ones that you may not be aware of is that it affects the spinal cord's on or off switch. So negative emotions lead to the release of chemicals that increase the spinal cord sensitivities, whilst positive emotions decrease it. Of course, therefore, increasing the chances of messages getting to the brain, or positive emotions decreasing it. So returning to our glass analogy, negative emotions make the glass smaller. So water will overflow sooner, body change messages are more likely to get up to the brain. A bigger glass, as with our positive emotions, won't overflow. So change messages are less likely to get there. So returning to our loop, the loop continues and will only reduce and stop when two situations occur. And of course, if you have pain, these are the two situations that you want to happen. First, when the body's nerve receptors stop detecting change. So as I said, any injury to our bones, muscles, tendons, ligaments will pretty much have healed within 3 months. So this is when the damaged body change messages will have greatly reduced or stopped. So to repeat, earlier I told you about the chronic pain and acute pain having a 3-month barrier. After 3 months, there are few, if any, signals from the body saying that it still needs to heal. Second, for the pain to stop, the brain needs to decide that we are safe. If both of these things happen, the protective responses stop, and we have a classic injury or pain, acute injury or pain situation. The person is free from pain and has recovered within 3 months. However, and I'm guessing this may all be the situation for most of you who are here today, unfortunately, we know that pain can continue beyond 3 months. Obviously, here in the realms of chronic pain. So, what is going on? Well, for whatever reason, the brain continues to decide that that person is in danger. Why? Well, maybe they have had more or bigger concerns develop over the previous 3 months. So we maybe have more triggers and less positive experiences or less negative experiences. So in addition to the earlier beliefs and memories, so these are all ones you've seen before, it may be that you've been told that surgery is the only option. Many people aren't keen on having surgery. Or maybe, particularly as pain progresses, you might feel I'm alone. No one understands or wants to hear about this. I hear this far too much from my clients, unfortunately. Or maybe they've been have a worrying diagnosis, or the medics can't find a cause, which often is far more alarming than knowing what something is. Alternatively, maybe things don't seem fair. Maybe important parts of your life are missed, or revenge is all consuming. So, for many reasons, because of this, and despite the healing, after 3 months with chronic pain, the person's brain and body have adapted to be on high alert. So, anyone with chronic pain will have an increased number and sensitivity of nerve receptors. This means they now detect more subtle changes in the body environment, again to temperature, chemicals, pressure, and stretch. This leads to more messages going to a sensitive spinal cord, which, made worse by negative emotions, will have a lower threshold, increasing the likelihood of messages being sent to the brain. The brain has also adapted. It's formed super fast connections across its pain network, so it's now on high alert. It's learned to pay attention to all the triggers it signifies as dangerous, and then to quickly set off protective actions. There is little doubt within the pain science world that after 3 months, the brain has learned to feel pain. So the feedback loop continues, and the long and short of it is the person with chronic pain has, for survival purposes, adapted to ensure they're ready to respond to anything that they have learned to believe is dangerous. Here, we often hear people talking about the unhelpful, faulty alarm. There's no fire, no burglars, but the alarm bells just keep ringing. One term which you may hear reference to, and is a really key term within chronic pain, is central sensitization. And this is what central sensitization means when our body is all on high alert and that fire alarm or burglar alarm is ringing unnecessarily. This is why, and if you have chronic pain, you may well be familiar with these, this is why pain continues, why it gets worse, why sometimes it's with us and sometimes it's not, and also why it moves around the body for no explicable reason. So, good news. Hurrah. My aim this evening was not to depress you all thoroughly. Alternatively, the aim of this evening is to tell you that all of these adaptations are reversible. So the brain and body will always adapt to the end of our days. So it can either keep on adapting to make pain, or by reducing danger and increasing safety, we can reverse these unhelpful adaptations and reduce pain. Yes, it takes varying amounts of time, from seconds to years, and often patience and perseverance to make the right changes to help, but pain can and will reduce if you do the right things. Excuse me, I have a drink of water. Before moving on, there is one thing I must really emphasize, that pain is never all in the mind. That means it's never made up. All too often I hear people say that they, which could be families, friends, colleagues, think I'm making it up. Or maybe if you've been told that scans and investigations are coming back normal, you are made to think that you're making it up. This is very damaging. Yes, pain is made by the brain 100% of the time, but everyone should know that pain is very real, even though it's changing and moving around can make it very confusing. So, what do we do with all this information? Well, let's move on to some general practical ways of how to improve recovery. things that I do with people all the time to help them recover better. The first thing I would say is a matter of timing, really. Don't wait for many things to happen. First of all, take control right from the beginning. All the things I just mentioned to you mean that we can affect how our memories and our thoughts and all those other kind of things affect us. And therefore, right from the very start, it can affect how we respond to injury and pain. Really key is to stay calm and positive. This is something I particularly say to people who have when they have flare-ups. Flare-ups obviously can be very alarming, but just be aware it's just the brain throwing in a curveball. Nothing has changed. The body is still the way that it was before the flare-up. So staying calm and positive will help with that. So get good advice and support. So obviously, if it's a new situation and it appears to be an emergency situation, so things like chest pain extending down the arm, clear fractures, those kind of things, obviously we go to A&E. If it's not an major emergency, but pain has not improved or has got worse after 2 weeks, then please go and see your GP or your trusted osteopath and physio. This is important so they can make sure that there is nothing more dubious kind of going on. Other relevant health professionals might also be able to help, but please make sure that they are pain informed. Alas, this is not the case throughout our medical systems. Generally, as pain continues, please do not wait for others to fix or reduce it. Likewise, please do not just rely on pain meds. What I've just explained to you in terms of how pain works means that we can do a lot to help ourselves over and above other people coming in to do things. So even if you are waiting for an appointment, please do the things that I'm just about to tell you about. So pain education is absolutely key. So there's been some great research going on recently looking at the effects of pain education, and they found out in the most amazing randomized scientific against the best control groups possible trials, they're finding out that pain education is the safest and one of the most effective ways of reducing pain. In terms of effectiveness, it's as good as the best painkillers, but obviously there is no side effects to pain education as there are with other pain meds. So obviously today we looked at the basics of pain education that apply to all people with MSK pain situations. There is, however, an awful lot of information out there, and much of it is incorrect. So if incorrect information, as you just said, in terms of the way that our beliefs and our thoughts kind of come into it, can lead to unnecessary danger and then can create pain. So be careful as you look for information. Generally, with chronic pain, I question anything or anyone that doesn't recognize the role of central sensitization. Remember, when our body's on high alert, or who's not open to the idea that there can also be other solutions than physical ones, and also anything that says pain can't improve or will get worse. Be particularly wary of social media groups. Yes, they can be a place where you can gain support from those experiencing similar concerns, but many of my clients say that they can be an echo chamber for doom and gloom. Alas, most of the people on these sites are people who are not improving and are not gaining support from pain-informed medics. I would like to say this just applies for social media, but alas, charities and even the NHS website can remain out of date on pain science. So one thing that you can do is to understand your own pain. So take on board what I've said today. Obviously look for other kind of information. I can give you some towards the end if you're interested. But pain is very personal. Your life, situation, and the activities, thoughts, and emotions that would trigger it will be totally unique to you. So as a basic starting point, consider what brings on the pain. Notice, are there any particular activities? Are there any particular thoughts? Are there any particular emotions that bring that pain on or ramps it up? Likewise, a really key thing, one of the things I often start with when I'm working with people is what reduces or stops pain. Obviously, the more you know about what reduces it and stops it, obviously, the more you can apply them. So please consider these two questions and then use and act with that wisdom. The third key thing is do what you can to reduce the danger and increase safety. So clearly, pain education is very important for reducing the danger messages which are out there. Unfortunately, injury and pain brings with it many pressures. So not only worried about taking medications, visits to doctors and hospitals, not finding a physical problem to solve. All these things will add to the stress levels, which are going to amplify the pain. And of course, this is over and above and often escalates other life and work stresses. So we've seen how our fight and flight response systems contributes to pain and central sensitization. So anything that helps you to reduce stress, either in the short term or in the longer term, is helpful. So cognitive behavioral therapy, the kind of classic psychological approaches are known to help, but also more simple things like learning to breathe deeply. Yoga, of course, Sherry's wonderful yoga might be helpful. But at the end of the day, anything which works for you in terms of reducing stresses is a good thing. One thing which is also worth mentioning is that we know that experiences of big trauma, so physical, sexual, emotional abuse, neglect, and family dysfunction, particularly in childhood, increases the likelihood of chronic pain. And also, if you have these and you're exposed to normal life stresses and hassles, that you're more likely to experience intense pain. So if in your past or currently you have trauma, seeking support to resolve that may well be helpful. Likewise, if you're aware that you have mental health concerns, they might be worth looking into as well. So if I work with people, for example, as I'm not a clinical psychologist, I refer people who I'm concerned about to a clinical site to help them with mental health concerns, and then often work alongside them for the pain as well. But those two approaches can certainly help if you have trauma and mental health concerns. On the positive side, of course, we know that positive emotions are going to reduce that sensitivity in the short term, and then if we keep doing it also into the longer term. So please give some thought to all the things that make you feel safe and to all the things that give you any positive emotion. So it could be kindness, it could be gratitude, it could be contentment, it could be joy, any positive emotions whatsoever. Anything that makes them is a good thing to do. So even simple things like walking outside. Now I know that's harder as the weather gets colder, but even walking outside, getting some fresh air, seeing a tree or some birds or something is a good thing. Likewise, maybe it's in the evening, snuggling up in the settee and listening to one of your favorite funny or interesting podcasts. Never underestimate the simple things that can help you. One of the key things that I often hear people say is that I'm frightened to move, I'll damage it more. Indeed, fear of movement is one of the most common reasons why people come to see me or why physical health practitioners refer to me. So yes, sometimes in the first days of an injury or pain, it is better to rest to help the early healing process. But generally, we need to keep moving as we can. And the important phrase here is safely. We need to keep moving safely. Why is this? Well, just as in any situation, if we are not moving or we're moving differently, we're guarding, we're holding a body part in a different way, maybe not walking naturally, what will happen is that our body, our muscles and all the things in our body will become shorter, tighter, weaker, and our joints will become stiffer. This in itself will lead to more pain. And you've guessed it, this is going to turn out to be a bit of a vicious cycle. The more pain you have on movement, the more you're going to fear it, the less you're going to do, the shorter your muscles are going to get. So we're caught in a little bit of loop here until, just as even anyone without pain, we're going to end up that we are progressively deconditioned and we lose function and disability and way towards disability. So this in itself is, from what I find, is often one of the biggest causes of people with chronic pain, this fear to move. So conversely, what we need to do is to work out how to move safely. And what I normally do for this is say to people, okay, well, what can you do? What are you comfortable to do? And they usually give me an answer, say, oh, I can walk for 10 minutes. And then I go, can you really walk for 10 minutes? And they go, or maybe I can walk for 5 minutes. And I go, can you really walk for 5 minutes? And I can walk for 3. Sure? Yes. let's go for a walk for 3 minutes. So it really is a case of being honest with yourself about what you can do safely. Then you start off with that and then you build up very slowly. So if we can start to move safely, what happens? Well, then we get increased moving confidence. We will have improved body health, as you've just been talking about. And also, obviously, with the psychological benefits of movement and exercise, it's going to increase our positive mood states as well. All of this is going to decrease sensitivity of our nervous system. It's going to help to turn that alarm down. Once again, we have a lovely little feedback loop, but the more we are, oh, I've got my arrows going the wrong way, sorry. The more we are have decreased sensitivity, the more we're going to be able to move, the more we're going to get confidence, improved health, mood state, and it keeps going round and round, and the pain does and will reduce. So one of the last things I kind of want to mention really is how our lifestyle and behaviors can also affect pain. And I think this is kind of one of the really missed opportunities. There's lots of information out there nowadays, also in the work environment, about classic lifestyle behaviors, and we're not talking about them enough in relation to pain, but these are often things which we can do more readily and sometimes without support as well. So one of the key things, you remember me saying about how the fight and flight response, when we have danger, prevents our rest and sleep. Well, obviously, rest and sleep are important to help our body recover and repair and restore. So what will help you is going to be personal to you, but it often includes making more time and being honest or disciplined with yourself about how you engage the demands of today's world. Often I talk to people and we are just always so much on the go, and we always kind of feel that if we don't keep doing things, everything is going to fall apart. Sometimes it's a case of thinking, okay, well, realistically, what's going to help you now? If we do things differently now, that's when things can get more positive for you in the future. So one of the things to look to do is to try and look for opportunities to rest throughout the day. And also just basic sleep hygiene, like having a good bedtime routine, no blue screens before bed, no caffeine after 3 o'clock, all those kind of things, can help us to improve sleep. Another lifestyle, there's lots of information about nutrition, and this is likewise changing from what I'm kind of surrounded by this quite a bit at the moment. So our knowledge of nutrition is really changing just the way as it is about pain science. We now know that the gut, the immune system, and the brain are really closely linked, and that what we eat affects our mood states as well as the ability of both our brain and the body to repair. So one of the things that actually happens if we eat well is that it helps the microbiomes created actually help to break down those connections in the brain which are currently leading to pain. So that's actually quite a key thing. So obviously I'm not a nutritionist, I can't talk well on this, but for example, things like fast foods, processed foods, and refined sugars are known to increase inflammation. So it might be that nutrition support might be helpful for you. I want to say something about pain meds, because at the end of the day, even though there's now directives to decrease the amount of pain meds prescribed, it is still very much the first point of call when you go and see your GP. Please be careful with pain meds. They might give short-term relief, but know that no medication kills pain. I used the term painkiller myself by mistake earlier. We shouldn't be using that phrase. That kind of gives the wrong impression that they kill pain. Also, all pain meds will have side effects. So even the humble paracetamol now is known to have risk factors attached to it as well. So generally, NICE, the National Institute of Health and Care Excellence, are clear that no pain med is a long-term solution to pain. So if you are not taking, so you should aim not to rely on pain meds. Of course, if you already do so, please don't worry about that. Don't stress about that. But what I would suggest that you do is take on board some of the things that I've said. And from doing that, what I often help my clients to do is to actually build a plan using all this stuff with the intention of them going back to their GP and having the confidence to say, hey, I'm ready to start coming off my pain meds now. And then the GP will then help you, guide you, come off your pain meds slowly and safely. Please never do a cold turkey on them. Alcohol, I've never seen guidance on how much alcohol you should have if you have pain. I've looked for it often, but it's prudent to stay below the recommended limit of 14 units. I think the key thing that I always say to people is that if you start to drink alcohol to relieve pain, well, then maybe you need to start addressing that. We know that there's a link between the more you drink, the increase in sensitivity. So you often kind of find your way onto a slippery slope. And of course, there are organizations out there to help you if you feel that you are drinking too much or if you think that you are drinking to relieve pain. Oops, I thought there was another thing. What I was going to say is obviously there are different specialists out there which can help you change lifestyle behaviors. Well, obviously, psychologists can help you with behavior change. And let's face it, all of us find change difficult. So there we have it. My goodness, I am nearly to the minute on time. I've covered a lot, and believe me, there is an awful lot that I have left out. But there's a couple of key things I really want you to take away of you, and it is this. Injury and pain have many causes and thus many solutions. Typically, people have more control over pain and recovery than they think, and we can always do something to reduce pain ourselves. Thank you so much for listening. I hope it's been helpful. If you'd like any more information or get in touch with support, please take a screenshot. You can also find my details on the Putney Clinic website. I do have a LinkedIn and an Instagram account. I had a great flurry through September Pain Awareness Month and have not done much on it since, but for individuals, I try to put information out there on Instagram, and I'm hoping to do some videos soon to make them more interesting as well. So I hope that has helped. Thank you very much. Are you there, Sherry?